Dementia is a disorder that usually affects the elderly, where the elderly or the person affected by dementia usually forgets their name, forgets the people, their relatives, or their surroundings. We are at Nkulumane Clinic in Bulawayo, where ZARDA, an organization that is trying to put awareness in the community of Nkulumane about dementia. They are also incorporating epilepsy as well as other mental disorders.
To commemorate Dementia Action Week, the Zimbabwe Alzheimer and Related Disorders Association, ZARDA, gathered at the Nkulumane Clinic for a 4.5 kilometer awareness walk. The route ended at the Nkulumane 14 Terminus. The awareness campaign was sponsored by NICOZ Health Home Care and Nkulumane 12 Medical Center. Along the 4-kilometer walk, members of ZARDA and community members who had joined engaged with residents, explaining the purpose of the march. Sibonile Chinara, a volunteer with ZARDA, stopped to speak with an elderly man. He shared that he sometimes assists in caring for his 109-year-old mother, who is already affected by dementia.
Abadala yebo kodwa la kulezi insuku so affecta labancane but kakhulu uvame ebantwini abadala yela lizweni lalibabone begcinwa njani kunalabo abantu abadala
Ngilaye umuntu omdala umama ongizala 109 years.
Wow.
So uyaphakanyiswa uyathwali akhulume nje kuhle right khonokho nje dale khosi antonto umuntu omdala
isifo sakhona
ukuthi lo
singasathi ikuzenzisa ukukhohlwa isifo sakhona kodwa kufanele sibagcine kuhle abantu labo akula muntu owubizayo umkhuhlane lo uyaphongwenzakala so sabe sifuna ukuthi sifundisane thina iZARDA siyafundisana ukuthi hayi libagcine njani abantu labo lingabavalele endlini ngokuthi sebeliyangisa kumbe sihambe labo kuma-walk sibagqokise kuhle bavuke bagcinwe kuhle labo ngokuthi labo babe ngabantu njengami lawo kudala kwabo sibafide kuhle sibaphe ukudla okubafaneleyo.
On the concerning reality that dementia is now affecting young members of the community, Sibonile had to say this.
Kulezinto abazinathayo labazithathayo utshwala usubenza bakhohle lo mfana desihamba la nithi okunathayo kubulala ingqondo i-dementia ukuthi ingqondo iyafa mbijana ama-cells engqondo ayafa mbijana so abathatha ezidakayo bazibulala ingqondo labo bagcine labo sebenjani sebekhohlwa sebengani sekuyi-dementia sithi alcohol induced dementia le
sihamba thina singabe ZARDA sihamba sibonisana sihamba sifundisa njalo ngokomkhuhlane ye-dementia umkhuhlane okukhohlwa umkhuhlane wokulibala sithi umkhuhlane lo asokuloywa umkhuhlane onormal ojayele ukuvamba asebekhula abadala so isicelo sethu ukuthi sifundisane njenge-community sibambane izandla sibambisane izandla ukwenzela ukuthi abazali bethu bencedakale.
Millions of people around the world live with dementia and it's unknown until it has struck or until an old gogo, an old kulu or a relative who has lost his memory disappears.
Having walked the entire 4.5 kilometers, Sherilyn, one of the organizers and a ZARDA volunteer, spoke to some GBC News about dementia.
Sherilyn, yes. I'm now with Sherilyn, who's part and parcel of ZARDA. this work brings together ZARDA and other associations. What inspired this joint awareness effort for Epilepsy and Dementia Week?
What inspired it is that there is a lot of stigma around epilepsy and dementia, and it's not necessary. We're trying to educate the public and the community that these are disorders. They are medical disorders. The people who have them can't help having them, and they need our support and empathy and help. They don't need to be victimized.
Is there medication for dementia?
There is medication, but the medication is used to the symptoms. It's to fix the symptoms. There's no cure. There's no cure for dementia. It's from diagnosis to death.
Since the disease has no cure, Sherilyn explained that the medication given to dementia patients is aimed at improving their quality of life.
So what we try and do is we try and improve the quality of life of the people who suffer from it. In that way, we do use medications because there's different stages of the disease. And sometimes, as with any disease, if it's caught early, we can help them the most, and we can actually put in place coping mechanisms for the families, on how to cope with the different stages as they come.
There has been an increase in the number of people affected by dementia, both the elderly and the young. Sherilyn attributed this to diet and the fact that people are living longer. On the younger generation, she stated that drugs and substance abuse plays a significant contributing role.
Why we're also finding an increase with regards to the elderly now is because of improved diet and also modern medication, and people are living longer. So that's the reason why we're seeing more cases with the elderly. Amongst our youth, sadly, most of it is brought on by substance or alcohol abuse. And sadly, in the city, it's quite rife, and it really is. It's a serious worry because the youth are our future. Going on with that, we haven't, because we don't have the systems. We haven't as yet found it amongst children, but it is affecting children. They did do a survey in 2020, and there are, I think they said 700,000 children affected by 70 different genetic conditions in the world, and that is also very scary.
NICOZ Home Care, the sponsor of the walk, was on the hand to check blood pressure and diabetes. Sherilyn noted that it is advisable for patients living with epilepsy and dementia to have their vitals checked regularly. A young resident of Nkulumane who called himself KB shared his thoughts with SimGBC News.
I-advise mina engasinika yona as a youth, let's do away with ama-drugs and ama-energy drinks lawana abhaliwe ama-energy drink i-recommendation 1 or 2, I think approximately ngelanga uyasala alright, but unga-exceeda that yikho kwenza igazi umzimba inhliziyo ichaye kakhulu. So hayi, let's do away with ama-drugs gents. Hayi, asibalekele izidakamizwa gents, ngibonani singaba ne-future right, singakubalekela lokudlala.
Sibonile Chinara then returned to state that the persons living with dementia need love. They do not need to be hospitalized nor cared in a home. What they need is the regular care they were used to when they were well.
ZARDA assists patients or persons with dementia. Now I'm with Sibonile Chinara, who is going to articulate how persons or elderly people, even young people that are affected by dementia are kept or are treated, or how we live with them. Good afternoon.
Good afternoon. Thank you for having me.
Yes, we are passionate about dementia patients. The thing is that they don't have to be hospitalized, these people. We want them taken care of at home. But for you to be able to take care of at home, that's why we offer training. So basically, they need love and they need you to pay attention to them.
Sherilyn added that ZARDA currently does not have an office to operate from, and that the organization urgently needs such help.
Someone missed you today, where would they get in touch with you for assistance, maybe the relative with dementia or epilepsy?
Yeah, that's a very good question because we actually we don't even have an office. Although we've been going for 8 years, and because we're volunteers, we all basically work from home. So we've just got flyers with our numbers on, and they can call those numbers. And if that specific person can't help, they will, forward them to other people. I know that our numbers are coming up on Meta. We've already had people reaching out to us. We've had one recently from the Swingo. But at the moment, there's only, as far as I know, an office. Our head office is Harare. Then we've got our little branch here in Bulawayo. We have gone ourselves and done trainings in Kwekwe, and we do have a representative in Kwekwe. But again, we need finance.
Would you want an office? Would you need an office? Do you need an office?
An office would be helpful, or just a place, a drop-in centre where we could have volunteers there certain days of the week at certain times, and that we can get people to, come there and they can ask for help.
You have heard it from Sherilyn. She's saying ZARDA needs an office so that they can assist in persons affected by dementia. They are working from their homes, they are volunteers. You can only find them or contact them using their numbers. So if there is anyone out there who can volunteer an office, pay for an office for ZARDA to continue assisting in this disease that is affecting both the young and the old.
The day ended with a Zumba exercise session for the participants. This has been a ZimGPC News production.